Good evening. How are you all? Let us begin with the orthopedic subject. This subject has a weightage of about 7 to 8 questions will come from this subject, and all of them you can score full marks in this if you study the subject carefully. This is a this will help you a lot. So please listen carefully, make notes and mark your answers in the comment box. Make this session as interactive as possible. This it will be helpful for you even if you are watching a recording. Then also be attentive, take notes. So the first question is identify the instrument. So look at the picture carefully. What is it is? A, is it Elizarov's fixator? B, is it rail fixator? C, K nail? D, proximal femoral nail? So what do you think is the correct answer? What is a rail fixator? Rail fixator is a monolateral fixator available in the form of rail or a telescopic multi-point assembly. In this, 6 millimeter pins are inserted into the bone. These pins are attached to different blocks which can move over a tract. According to need, the bone can be compressed or distracted as in Elizaro's ring fixator. However, it is less versatile as compared to Elizaro's fixator. It cannot be used at all in osteoporotic bone. It can be applied in compound fracture, limb lengthening, and infected non-union. Then coming to the Elizaro's fixator. Elizaro's ring fixator, it was developed by Gavril Ambrovich Elizarov, a Russian scientist, who described the law of tension stress, that is, principle of a new tissue develops between the distracted bone ends. In 1950, indications are limb lengthening, arthrodesis, infected non-union, and deformity correction. This was about rail fixator and Elizaro's fixator. Then the proximal femoral nail anti-rotation (PFNA) device is a short intramedullary nail which uses a spiral blade device to obtain fixation in the femoral head rather than a conventional screw. Then Kunschner's intramedullary nail. Kunschner's intramedullary nail or K nail. It is a German surgeon. Kunschner made this nail for fixing fracture of shaft femur. It is hollow, incomplete tube, and there is a slot or gap in the circumference of the hole of the nail, which allows it to bend slightly on the tensile surface of femur, that is anterolateral. As it is hollow, it maintains bone marrow continuity and preserves bone nutrition, and also allows guide wire to pass when it is used. It has clover leaf cross section, which prevents its rotation within the medullary cavity. It has two blunt ends, which reduces the chances of cortical break while insertion. So the correct answer here is rail fixator. This is a rail fixator. Identify the given splint. In orthopedics, they can show any type of instrument and they can ask its name, its use, its application, its contraindications. So you have to be thorough with that. Identify the given splint. A, dynamic finger splint. B, sugar tongue splint. D, cock-up splint. C, cock-up splint. D, knuckle bender splint. So what do you think is the correct answer here? A, dynamic finger splint. B, sugar tongue splint. C, cock-up splint. This cock-up splint is a static wrist orthosis, can be used in wrist pain, de Quervain's disease, Colles fracture and carpal tunnel syndrome, wrist drop, and hemiplegia. Cock-up splint is a static wrist arthrosis that can be used in wrist pain, de Quervain's disease, Colles fracture, and carpal tunnel syndrome, wrist drop, and hemiplegia. Then dynamic finger splint. Knuckle bender splint. Knuckle bender splint simultaneously flexes the metacarpophalangeal joint of all the digits without blocking IP or wrist. It is used in case of ulnar palsy. Then dynamic cock splint. It extends the PIP DIP wrist joint passively. So what do you think is the correct answer here? It is the cock-up splint. A football player falls on outstretched hand while kicking the ball and felt pain at wrist joint immediately after falling. Identify the fracture. It is a Galeazzi's fracture. What is the use of given instrument? To hold the bone and plate, to hold bone fragments with traction, to cut the bones for creating gap in wound. It is to hold the bone and the plate. You click the link in the description box to join my 3-day ultimate NEET PG breakthrough blueprint masterclass, which is free of cost, and you can stay in the WhatsApp group till you are clear the examination. I will be giving the. You can also subscribe this channel, so you will get videos every now and then. And if you hit the notification will come to your email. So the earliest sign of compartment syndrome of leg is A. Tingling or numbness. B. Skin mottling. C. Pulselessness. D. Pain on passage stretch. It is pain on passage stretch. What is the most common sequelae of traumatic shoulder dislocation in young adults? A. Frozen shoulder. B. Recurrent shoulder dislocation. C. Normal shoulder healing and movements. D. Subcapsular tendinitis. It is recurrent shoulder dislocation. In the fracture seen in the X-ray below, what is the most commonly expected vascular injury? A. Brachial artery. B. Radial artery. C. Ulnar artery. D. Cubital vein. It is the brachial artery. What is the eponym of fracture shown in below? Well, it is a Monteggia fracture. An athlete suffers a fracture as shown in the knee X-ray below. How is the fracture managed? A. Tension banding wiring. B. Compression plating. C. Internal fixation. D. K-wire fixation. It is tension band wiring. Which part of second metatarsal is involved in March fracture? Here in the X-ray you can see the March fracture. So which part is involved? It is the neck. Which of the following is incorrect about PCL, that is posterior cruciate ligament? It is a main restraint in posterior diatest. B. It is an extrasynovial structure. It is a main restraint to internal rotation. It originates from anterolateral aspect of medial femoral condyle in the area of intercondyle motion. It is a main restraint to internal rotation. About giant cell tumor, all are true. Commonly presents in 20 to 40 years of age group. Matrix consists of proliferating mononuclear cells. Osteoclast giant cell constitute the proliferative component of tumor. D. It is a benign tumor which may have lung metastasis. So the correct answer, except osteoclast giant cell constitute the proliferative component of tumor. What is the diagnosis? Aneurysmal bone cyst, giant cell tumor, osteosarcoma, osteoblastoma. It is a giant cell tumor. Identify the deformity. A. Swan neck deformity. B. Botner deformity. C. Jersey finger. D. Mallet finger. It is swan neck deformity. Glucosamine supplementation is given in A. Arthritis. B. Diabetes. C. Cataract. D. Asthma. It is given in arthritis. Patellar Clunk syndrome scar is present at superior pola patella and impinging on A. Femoral component during flexion. B. Femoral component during extension. C. Inferior pole during flexion. D. Superior pole during extension. It is femoral component during extension. Most specific for diagnosis of ankylosing spondylitis is A. HLA B27, B. Bilateral sacroiliitis, C. Lumbar movements, D. ESR. It is bilateral sacroiliitis. What is the most likely cause of abnormalities in the wrist position? A. Scaphoid fracture, B. Colles fracture, C. Osteoporosis, D. Rickets. It is rickets. A 75-year-old female had a fall and an intercoccygeal fracture that is due to A. Osteoporosis, osteopetrosis, Majet's disease, and metastasis. It is osteoporosis. A 55-year-old male presents with severe backache for 10 days and urinary incontinence with a history of intervertebral lump disc prolapse. There is no history of fever and weight loss. What is the likely diagnosis? It is Cauda-Equina syndrome. All of the following are true about Spengel shoulder. Associated with diastole-metamelia. B. Most commonly associated with Klippel-Feil syndrome, usually associated with dextrocardia, associated with congenital scoliosis. Usually associated with dextrocardia. What is the likely diagnosis of the image shown below? Coxa magna, coxa valga, coxa vara, coxa sultans. It is coxa vara. Meralgia parastatica is due to involvement of A. Lateral cutaneous nerve of thigh, B. genitofemoral nerve, C. ilioinguinal nerve, D. saphenous nerve. It is lateral cutaneous nerve. Identify the deformity seen in the picture. Hallux valgus, hallux varus, cubitus valgus, rheumatoid nodule. It is hallux valgus. Haglund's deformity is seen in which joint? Elbow, knee, wrist, ankle. It is ankle joint where Haglund's deformity is seen.